In this episode of Healthy News, we will look at a supplement you can use in the fight against the coronavirus. Some doctors are already using this supplement as an important addition to their current treatment protocols. And the supplement is a proteolytic enzyme. Proteolytic enzymes could be one of the most important factors in overcoming a viral and bacterial infection, especially in pediatric and geriatric patients and those with a compromised immune system. These important molecules not only optimize your immune system, they can also help reduce the severity of COVID-19 symptoms and the side effects of the COVID-19 vaccine. Let's take a look at proteolytic enzymes. Proteolytic enzymes are enzymes that break down protein into smaller chains of amino acids and to their individual amino acids. Enzymes are essential to life. They catalyze, facilitate, or speed up chemical reactions within the body. The role of proteolytic enzymes in the case of viral and bacterial infections comes into play by aiding in the removal of viruses and other foreign proteins from the circulation and tissues. They also help break down circulating immune complexes. This greatly diminishes inflammation. When circulating immune complexes build up in the body, they can also lead to inflammatory conditions such as rheumatoid arthritis. Immune complexes occur when an antibody binds with an antigen in this case being a virus. The antibody then neutralizes the virus and then it is cleared from the body. In the scientific article Frontiers in Pharmacology, a paper published Serrapeptase, a serine protease anti-inflammatory, fibrinolytic and mucolytic drug, can be a useful adjuvant for the management in COVID-19. This preparation was made by a pharmaceutical company, so they take the serrapeptase and do something with it and change its name so it can be called a drug. Proteolytic enzymes can be useful in the treatment of nosocomial, viral and resistant infections, especially in pediatric and geriatric age groups, due to its relative safety, less tolerance and resistance and its synergistic effects. Several proteolytic enzymes act in an orchestrated manner to control and coordinate the entry of virus, replication, and diffusion in the host cells. Thus, the proteolytic enzymes could be important in interfering with the virus machinery in host cells and suggested useful in COVID-19. Our proposition is to repurpose a drug that possesses not only mucolytic properties but also a potent anti-inflammatory and antimicrobial properties with a long history of safe clinical use. A mucolytic that could be advantageous over others in COVID-19 treatment due to its wide range of therapeutic effects, including anti-inflammatory, antimicrobial and atheroprotective, and also antithrombotic and antifibrinolytic properties. Antithrombotic meaning preventing blood clots, and also fibrinolytic meaning breaking down existing blood clots. Based on these properties, we opine that these properties may provide better therapeutic benefits in limiting the severity and progression of the disease by reducing the risk of respiratory complications and related death. Patients who took proteolytic enzymes had less severe symptoms and faster recovery. The enzymes also aided in the breaking down of the clearing of respiratory secretions and could breathe easier. The usual dose of serrapeptase in a majority of the human studies range from 10 to 60 milligrams a day in divided doses, with the most preferred dose of 10 milligrams 3 times a day on an empty stomach. Usually it is used for 2 to 4 weeks depending on the aim of therapy and the outcome. The dose of 10 milligrams is considered to be equal to 20,000 units of enzyme activity. Therefore, we propose that the dose of 10 milligrams 3 times a day could be examined as an adjuvant in the COVID-19 treatment. Using serrapeptase can be virtuously justified, being safe and effective and devoid of side effects that commonly develop with the use of conventional mucolytics that may cause sedation, euphoria, gastrointestinal disturbances, respiratory irritation, and constipation, probably due to the absence of any interaction with receptors. A scheme is presented in Figure 1 to depict the possible mechanisms and the effects of serrapeptase on mucus production, infection, inflammation, and immunity in the context of SARS-CoV-2. There are no undesirable adverse effects on bone marrow or the immune system, even with high and prolonged enzyme administration. Even the consumption of 3,700 tablets per day only produce mild diarrhea. A harmless alteration in the consistency, colour and odour of bowel motions may occur as a consequence of enzyme action. Nausea, vomiting and mild abdominal pain may be seen in some cases. Now, it is important to note that proteolytic enzymes can affect the coagulation pathway as they can break down existing clots in the body, and hence it should be not used with blood thinning medications such as aspirin, warfarin or Coumadin without the supervision of your doctor.